I am sure you must have seen young kids suddenly stopping their breathing. It's quite common and really frightening condition. People would take the child and run, and they shake their children, give mouth breathing, they shake, they do so many maneuvers to make the child breathe. This is called breath holding spells. Usually these kids, the usual age range is 6 months to 1.5 years. Due to some condition, maybe pain, frustration, irritation, anger, or some other stubbornness or something, they would stop breathing for nearly a minute, and they would become limp and lose their consciousness for maybe 1 to 1.5 minutes, and immediately after that they breathe again and become normal without any loss of consciousness, without any jerking or incontinence or any post-ictal confusion, no vomiting, no confusion after 1.5 minutes. This takes in the form of 3 or 4 types. This may be a simple breath holding spell. They just stop breathing for a minute, lose consciousness, improve. Sometimes they become pale during this episode, or they may become blue or bluish or cyanotic, or this may be a complicated type. So whatever said and done, the parents would be anxious, they will be running amok, they would think that the child is dying or about to die, so they do all sort of maneuvers like jerking, jolting or shaking or giving mouth breathing. So the best drug would be just pinch with a pain. It should invoke some pain. The child should cry, they should wake up from the loss of consciousness, they should give him a sufficient painful pinching on the hands or on the shoulders or on the skin or the legs. That's well and good, that's enough. You don't have to shake, you don't have to give a mouth to mouth breathing for these kids. It's said that this runs in families, 25% can occur or run in families. This can occur in 5% of the population, the age group being from 6 months to 1.5 years. Usually they outgrow this condition after 5 years. There won't be any seizure or epilepsy, and the immediate differential diagnosis would be an epilepsy or a cardiac arrhythmia causing a Stokes-Adams syndrome or some other neurological manifestations. The usual inciting cause would be pain or frustration or anger or irritation, or due to something with the kid or the baby, they become stubborn or so. So you don't have to worry. The maximum thing you have to do is give some pain and see that the child breathe again. Then secondly, you have to ask for an EEG, electroencephalogram, in case just to rule out a seizure activity. Thirdly, you should get an electrocardiogram done, because sometimes some cardiac arrhythmia, QT prolongation, various QT prolongation syndrome are there. Sometimes that can get us to a cardiac arrhythmia. So you have to do a ECG and EEG. Blood test might show some abnormality like anemia and all, because these people are prone for the breath holding spells. So it's an innocuous condition, it's a benign condition. The only remedies give the kid little pain to the shin or to the hands or to the shoulder. Don't shake, don't jolt or don't shake the patient. You shouldn't shake so much so that this would damage the cervical spine. They can be bleeding into the brain, some subdural hemorrhage or subrectal hemorrhage, or damage to the cervical cord, or can even fracture the ribs or the long bones. So you don't have to worry about these particular conditions, and you need to reassure the parents only, and you can replenish iron or some other medication. Maybe some stimulants are available, paracetamol and some other medication. The only problem is that you have to roll out a seizure, but that is very rare with this presentation. So I would like to stop here by telling you that breath holding spell is common, is a benign condition. You don't have to get frightened with this condition, just reassurance is enough. Maybe you need an electroencephalogram, ECG and EEG and some blood tests, that's all. So thank you very much.